Intravenous urography, IVU, is an X-ray procedure used to assess problems in the urinary tract. The urinary system consists of 2 kidneys, 2 ureters, 1 urinary bladder, and 1 urethra. The function of this system is to maintain purity and constancy of internal fluid. To examine urinary system, an iodine-based contrast agent is injected intravenously. This material will be secreted by the kidneys into the bladder via the ureter. What is intravenous urography used for? 1. Duplication in pelvic system. 2. Abdomen or pelvic mass. 3. Urinary tract infection. 4. Renal failure. 5. Hypertension. 6. Hematuria, blood in the urine. 7. Prior to pelvic surgery. 8. Hydronephrosis. 9. Flank pain. The patient must have an appointment for an IVU procedure. A consent form should be signed by the patient, and any question with regard to the procedure should be explained to them. Patient preparation is essential to reduce intestinal gases and to remove fecal material that may obscure different parts of the urinary system and may result in losing some diagnostic information. Patient with allergy will be required to take prednisolone. Patient preparation for an IVU includes light evening meal, bowel cleansing, laxative, nothing by mouth after midnight, a minimum of 8 hours, enema the morning of the examination. Check the patient ID before starting the examination. Before the excretory urogram, all clothes except shoes and socks should be removed and replaced with hospital gown. The patient should void just before the examination in order to reduce the dilatation of contrast medium in the bladder and lower the risk of bladder rupture. Patient age and weight will determine the amount and the concentration of the contrast media used. Patient supine with pillow for head and arms at side away from the body. The center point to level of iliac crest. Here we take the scout film or plain film for 4 reasons. Verify patient preparation. Determine whether exposure factors are acceptable. Verify positioning. Detect any abnormal calcification or the presence of metallic artifacts. For the control film, KUB, the center point is midway between the highest point of the iliac crest, with a central ray perpendicular to the table. After positioning, the technologist selects the exposure factors from control panel that's suitable for the patient. In control film, the entire urinary system is visualized, from upper renal shadows to distal urinary bladder. No rotation or motion should be noted. For the kidney area, the center point is midway between the highest point of the iliac crest and the xiphoid process, with the central ray perpendicular to the table. The nurse prepares the contrast media syringe. The radiologist selects the injection site, then places the tourniquet 3 to 4 inches above the site. To confirm the site, the radiologist palpates the vein after the tourniquet is in place. Then he cleans the area with alcohol using a circular motion from the center outward. Butterfly needle method is used. The radiologist observes the tubing attached to the needle for retrograde flow of blood. If no blood is seen, slight adjustment to the needle position is applied. Once the needle is in the vein, he firmly secures the catheter in position with tape and withdraw the stylet. Later, he will release the tourniquet, uncap the tube of the catheter, and connect the syringe, ready to proceed with the injection. Immediately after injecting the contrast medium, the kidney area will be X-rayed. In the immediate film or the nephrogram, The entire renal parenchyma is visualized with some filling of the collecting system with contrast medium. After that, the 5-minute film is taken to determine symmetrical excretion of the kidneys. This image is valuable for assessing the need to modify the technique. If the compression was required to enhance the filling of the pelvic-helical system and the proximal ureters, the device is placed midway between the anterior superior iliac spine over the ureters. The 15 minutes film with compression demonstrates the application of such device and its advantage. Filming the urinary system immediately after releasing the compression can assist symmetrical renal function. Oblique views. The oblique view is used to remove the superimposition of the ureter from the spine. The downside ureter will be free from the lamina of the spine, whereas elevated side kidney will be parallel with the table. The patient is instructed to wear his clothes and drink fluid in the waiting area in order to fill his urinary bladder. He will be asked to return to the X-ray room once he feels his bladder is full. Full bladder film is used to assess the shape and the size of the bladder. In addition to that, it can be used to examine prostate enlargement. The X-ray beam is centered 5 cm superior to the symphysis pubis, with 10 to 15 degree caudal tube angulation to project the pubis inferior to the bladder. Post-void film. This image is obtained to assess bladder emptying and to investigate bladder tumor. It can be used to confirm uretrovesical junction calculi. The procedure done in this documentary included all the views taken for an IVU. Each hospital have devised its own routine and modification. The routine procedure in King Khalid University Hospital includes AP anterior-posterior control film, immediate film, 5-minute kidney area film, and if it doesn't satisfactory, then we should use abdominal compression to improve visualization. 15-minute compression film, release film, full bladder film, and anterior-posterior post-void film. Some other points about an intravenous urography. Excretory urography and IVP are terms commonly used for an IVU procedure. Intravenous urography is not done as often as it used to be. This is because of the development of other scanning techniques, such as ultrasound, CT, and MRI. Contraindications: anuria, hypersensitivity, sickle cell anemia, patient taking glucophage, severe hepatic and renal disease, multiple myeloma, pheochromocytoma, congestive heart failure, renal failure, acute or chronic, and diabetes, especially diabetes mellitus. Reactions. Contrast media reactions can be classification into mild, moderate, and severe. The mild reactions include nausea and vomiting, hives, urticaria, itching, sneezing, extravasation, burning or numbness at the injection site, and vasovagal response, fainting. The moderate reactions include excessive urticaria, hives, tachycardia, rapid heartbeat, giant hives, and excessive vomiting. The severe reactions include very low blood pressure, cardiac or respiratory arrest, loss of consciousness, laryngeal edema, cyanosis, bluish discoloration, difficult in breathing, and profound shock.